Coreg is a beta blocker. Beta blockers affect the heart and circulation, blood flow through arteries and veins. Coreg is used to treat heart failure and hypertension, high blood pressure. Coreg is also used after heart attacks that has caused your heart not to pump as well. Active ingredient carvedilol. Indications. Coreg is used to treat high blood pressure and heart failure. It is also used after a heart attack to improve the chance of survival if your heart is not pumping well. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. These drugs work by blocking the action of certain natural substances in the body, such as epinephrine, on the heart and blood vessels. This effect lowers your heart rate, blood pressure, and strain on your heart. Carvedilol belongs to a class of drugs known as alpha and beta blockers. How to use. Oral use. Essential hypertension. Carvedilol may be used for the treatment of hypertension alone or in combination with other antihypertensives, especially thiazide diuretics. Once daily dosing is recommended, however the recommended maximum single dose is 25 mg and the recommended maximum daily dose is 50 mg. Adults, the recommended initial dose is 12.5 mg once a day for the first 2 days. Thereafter, the treatment is continued at a dose 25 mg per day. If necessary, the dose may be further increased gradually at intervals of 2 weeks or more rarely. Elderly, the recommended initial dose in hypertension is 12.5 mg once a day, which may also be sufficient for continued treatment. However, if the therapeutic response is inadequate at this dose, the dose may be further increased gradually at intervals of 2 weeks or more rarely. Chronic stable and uninfectious a twice-daily regimen is recommended. Adults, the recommended initial dosage is 12.5 mg twice a day for the first 2 days. Thereafter, the treatment is continued at a dose 25 mg twice a day. If necessary, the dose may be further increased gradually at intervals of 2 weeks or more rarely to the recommended maximum dose of 100 mg a day divided into 2 doses twice daily. Elderly, the recommended initial dose is 12.5 mg twice daily for 2 days. Thereafter, the treatment is continued at a dose 25 mg twice daily, which is the recommended maximum daily dose. Heart failure. The initial dose is 3.125 mg twice a day for 2 weeks. If this dose is tolerated, the dose may be increased slowly with intervals of not less than 2 weeks, up to 6.25 mg twice a day, then up to 12.5 mg twice a day, and finally up to 25 mg twice a day. The dosage should be increased to the highest tolerable level. The recommended maximum dosage is 25 mg twice a day for patients with a body weight of less than 85 kg and 50 mg twice a day for patients with a body weight above 85 kg, provided that the heart failure is not severe. A dose increase to 50 mg twice daily should be performed carefully under close medical supervision of the patient. Contraindications. You should not take Coreg if you are allergic to carvedilol or if you have asthma, bronchitis, emphysema, severe liver disease, or a serious heart condition such as severe heart failure, heart block, sick sinus syndrome, or slow heart rate, unless you have a pacemaker. To make sure Coreg is safe for you, tell doctor if you have coronary artery disease, clogged arteries, slow heartbeats that have caused you to faint, fluid retention, asthma or other lung problems, angina, chest pain, diabetes. Taking carvedilol can make it harder for you to tell when you have low blood sugar, a thyroid disorder, kidney disease, circulation problems such as Raynaud's syndrome, or pheochromocytoma, tumor of the adrenal gland. Tell a doctor if you are pregnant or breastfeeding. Coreg is not approved for use by anyone younger than 18 years old. Precautions. If a driving or has this activity until now how this medicine will affect you, your actions can be impaired. If it's getting up too fast from a sitting or lying position, or you may feel dizzy. If you're drinking alcohol within 2 hours before or after taking extended release Coreg CR capsules. Also avoid taking medicines or other products that might contain alcohol. Alcohol may cause the carvedilol and the controlled release capsule to be released too quickly into the body. Side effects. Get emergency medical help if you have signs of an allergic reaction to Coreg, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Call a doctor at once if you have a lightheaded feeling, like you might pass out, slow or uneven heartbeats, cold feeling or numbness in your fingers or toes, chest pain, dry cough, wheezing, chest tightness, heart problems, swelling, rapid weight gain, feeling shortness of breath, or high blood sugar, increased thirst, increased urination, dry mouth, fruity breath odor. Common Coreg side effects may include dizziness, slow heartbeats, diarrhea, weight gain, dry eyes, or problems wearing contact lenses.